Thank you. Thank you for inviting me for this wonderful session. I'm very happy to be part of this session. And Chandana, that's a very great question. And as you said, yeah, it was a very difficult part for me as well, because as a person with spina bifida, I never thought of getting married. My ambition in my life was to get a job and be independent, not depending on others. Especially, I should be independent of others, so that my parents will have the hope that, yeah, I'm settled down. So that kind of life goal was mine. I never thought of getting married. So I met my husband at my workplace. So he proposed me when I was 26. So we all know, right? So as we all have that incontinence and sensation issues and being on the wheelchair, so I thought like I never thought of getting married due to all these issues. And also I was also not interested to explain all these things, because for the people who were seeing me, they just think that I'm having some physical challenges. That's why I'm on the wheelchair. They don't know about the other complications which we all have, right? So when my husband proposed me, I was by the time when he proposed me, he didn't know anything about my condition. Then I told him that all these things are there and I'm not interested in marriage, and that's the reason I'm not even my parents are pushing for marriage, so I'm not considering to enter into any kind of relationship. But he was there. I mean, beside being person, he was always a good friend of me. So whenever there was any kind of need or something, he was always there during that time. So even after a proposal, I used to avoid and things, because I have that kind of fear how it would be. So and at one point of time, I realized that the importance of having an emotional support in one's life, and he waited for me till 2017, and by then I realized that the importance of him, because I'm very sure that he's a responsible person, and I'm very clear that he's not behind me because of sympathy. I'm very sure on that. So I thought of leading my journey with him, and he's a person without disability, and ours is an inclusive marriage. So we all know, right, how the situation would be when it comes to parents. So his side also against, and my side is also very skeptical. My relatives are why he wants to marry her. What is the purpose? Is there any other different motives? Like these kind of discussions at my side, and from his side, they all started thinking of how could I conceive and how the marriage life would be, and whether I'm the burden to him. So all such things, everything, all such dramas happens, and he was very strong. And after hearing all these sort of conversation, I also got the confidence. I realized that I have the confidence on him, and I showed that confidence to my parents that he's the right person. So that is how the journey happened. And we got married in the year 2017. By then I was 29 years. So this is about that journey, Chandana.
I'm really glad everything worked out, Divya. It seems like a really sweet journey, though it has its own difficulties, I guess. And we have all seen the pictures of your daughter. She's very, very adorable. So could you tell her name and how old is she?
Yeah, her name is Tira Punnagai. It's like my name is Divya and my husband's name is Rajesh. So we took that T and Tira. And in Tamil, Punnagai means smile. So when you put together, it is a ever-ending smile. The whole name is. So she's our ever-ending smile. So we want to spread that smile across the place wherever she goes. So that's the reason we named her Tira Punnagai. And now she is 4 years.
Oh, that's beautiful. And she has certainly lived up to the expectation of the name, because here we are grinning to the year's end. So it's beautiful. And also, I just want to ask you, when you and your partner decided to have a child, start a family, how far ahead did you start planning for it?
Yes, the moment we married, because we are very clueless about how it goes, right? Because we don't have any reference, like any person having a kid after spinal injury or with spina bifida. So we were very curious, and also we thought of meeting a gynecologist, and they were very confident that a childbirth will never affect because of this spinal condition. So they were very confident on that part, and they told about the folic acid supplement, because normally uh, other mothers will have 4 milligrams of folic acid, and whereas we have to have 5 mg thing. And the moment we approached a gynecologist, because we are very clueless, right? So when the moment we met her, she gave a list. I mean, considering my age factor, because I was in my mid 29, so she gave us all the procedures, like day 13th you have to take this scans, all such a big process she was explaining us. But we were just into that, because month after my marriage we consulted her, and we thought of going trying for another 3 or 4 months, then go into that procedures whatever she prescribed. Fortunately, I got conceived after 3 months of my marriage, and I continue to have that folic acid supplement. So that is the place we started.
That's really good to know. Thank you. We also have Nipuna and Neha on the team. Nipuna, on to you. I'm sure you guys have a few questions to continue.
Yes, Neha, can you start?
Yes. So welcome all. Welcome, doctor. So I have one question for you. It's like, how far one should start planning medical care if they want to have a baby? So how far, like from what time we should plan it?
I'm sorry, doctor. I think your mic is on the mute.
Okay, so first of all, I want to thank all the coordinators in the Spina Bifida Foundation for giving me this opportunity to attend such a wonderful meeting in lieu of Mother's Day. And I would really, accept that this is the first of its kind of meeting, and listening to Divya is very inspiring, and it is giving me a new outlook towards our patients who come with physical disabilities due to various reasons. And I think this will also enrich my experience. Thank you, Divya, for sharing such wonderful insights into the whole thing. So coming to Neha's question, Neha, you wanted to know that when should the preconceptional counseling begin, or when should a couple come to a gynecologist when they're planning for a baby? May it be couples like Divya who have some physical disability, or any normal couple, I would say. So Divya correctly said that, like any other normal couple, we usually say you should try for at least a year before you visit a doctor, because you don't need to undergo all those infertility investigations if you are young, less than 30 years of age. Then give yourself a choice to have unprotected relations. Definitely, you should avoid alcohol and smoking when you are planning to conceive. Start with your folic acid supplementation. The exact dose is like 400 micrograms for people who are not having any history of neural tube defect. But people who have a history of spina bifida or any neural tube defect should take 4,000 milligram dose. So that is the recommended dose, 10 times higher than the other normal population without any risk factor. So 400 microgram is enough for anybody without a positive history. But people who have a high risk factor, they should take 4,000 micrograms, 10 times higher. So the standard tablets which are available in Indian market are 5 milligrams, means 5,000 mics. That is what we prescribe. Fall white tablets, Cisfol, they are all 5 mg. So 5 mg once a day is good enough for people with positive history. And once the couple has tried for 12 months, if they are less than 30 years of age, that is the time they should go and visit a gynec to discuss if there's any issue with the fertility. And if somebody is elder than 30 years of age, then we say you should visit a doctor after 6 months, because your biological age is already on the higher side. So 6 months is the timeline when you should try without any protection. If it is not happening, if you are not conceiving, please come and visit a gynec. That's it from my side, Neha. We can proceed.
Now I would like to ask Nipurna to continue.
Yes, welcome all. So my question is for Divya. So how was your delivery throughout? Like, did you face any complications or any problems, or you would like to tell us something from your perspective?
Yeah, sure. Yeah, you asked about the difficulties what I faced during my pregnancy, right? Yes. So first of all, when I conceived, earlier I used to walk with calipers and elbow crutches. After I conceived, because I used to fall down also. So during my 3rd month, I fall a couple of times. So doctor advised me not to walk, at least for throughout that journey. So what happens is, after the days follows, I started depending on others. Whatever I did independently before that. Say, for example, even for transferring from bed to wheelchair, or going to washroom and other stuff, right? So I'm completely depending on others, which makes me stressed out, because whatever I have, I mean, at least like 60 to 70% I was independent. But post that, during that course of journey, I depended completely on others, even for small things also. And during that time, especially during the first trimesters, we have to visit restrooms very often, even for a normal person. And though with a person with spina bifida, we have incontinence also, right? So that frequent visits. And the most important other difficulties what I faced is bed sores, because due to increased weight and I'm not having any mobility, I was simply sitting, right, and just lying down and all. So I developed pressure sores and all during the month of 6th. So by the time I have pressure sores in my butt area, sides, and everything, so then when any person with spinal injury gets bed sore, the first advice is to go on prone. But in my case, it was not the case, because we cannot go on prone, right? Because when you are carrying a baby, you have to be on the sides only. So those were the challenges I faced, and definitely with the help of my parents, and I got in touch with the rehabilitation specialist to go through that journey of bed sores without any complications. So those were the major complications, because as the person with spinal injury, these are the two things: incontinence, both bowel and urinary incontinence, and as well as this pressure sores. Those were the major complications, I would say.
Yes.
Yeah,
thank you. And since we're already on the topic of incontinence, a lot of us sometimes go through incontinence during sex. So what is your take on the importance of destigmatizing and having such conversation with one's partner?
Yeah, my stand over here is we have to openly communicate to our partner, because this one we cannot, even if we hide, someday or other we cannot avoid it, right? So the first thing is we have to openly communicate to him, and he is also very understandable, right? So he knows what to do and what not to do. So the moment, and we should not take that as a liberty to go without any preparation, like before going to, because he understands us more, but we should not take that as an advantage, right? So we should prepare ourselves, like having that ICC and other bowel instance. It should not happen, right? So we should be prepared, and in such a way, if we go proceed, no problems. But at times, even some accidents will happen, right? So it can be, it is understandable, right? So that is how my first thing is, we have to openly communicate is what is our condition and how it would be. So that, because he will also understand the complications and all. So that is the only.
And also, a lot of us take the help of the catheter. So if you don't mind us asking, do you use one? And if yes, what are the difficulties you faced, especially during the pregnancy?
Yes. So I was suggested to go with ICC, but what happens is, during that time I developed UTIs. Multiple times it happened during that. So doctor advised me to go with the indwelling one. Even that also didn't work out. I was constantly developing multiple UTIs, and due to which I got fever and other complicated symptoms. So then doctor advised me not to go with that. At least during this course, we'll plan about this bladder thing after pregnancy journey. So what I've done is, I simply have diapers, and I use, even if it's also we used to change. So that is how we manage. Because if I go with that catheters, that I had other symptoms and all, right? So in order to avoid that, I didn't use during those journey. That course of 7 to 8 months, I didn't use that.
Yes. Have you ever used medications like toleratin and oxybutynin? It is generally used for hyperactive bladder. Have you ever taken those even pre-pregnancy period of time?
No, I have not used that. No.
I guess this question could be led to Dr. Seema Sharma. Doctor, what would you say? Is it safe on women's part to take active bladder medication during the pregnancy?
See, the thing is, Chandna, there is not enough evidence to prove that these medicines are safe during pregnancy, because we don't have enough trials in the pregnant women. So the dictum goes for, as it is for any other medicine where we don't have enough data, like the benefits, if there are, benefits which outweigh the risk, means there is a woman who is not able to manage. As we heard Divya, she was very nicely able to manage her incontinence with diapers, and she didn't need to, use the intermittent catheterization to avoid the risk of urinary infection. So if somebody can manage it without the medicine, that's the first line of action. But in case somebody is not able to cope up with the incontinence part, then yes, the benefit would outweigh the risk of giving tolterodine or oxybutynin. Though there is data in the animals which says that 20 times higher dose when it is given, it may cause some minimal side effects to the animal fetuses. But there is not enough evidence to prove that it is absolutely safe. But still, we can use it guardedly. If somebody can't do without it, then yes, of course, you have to offer it to the patient. Yes.
Yes, sir. Nipuna, Neha, anything on your side?
Okay, so Dr. Seema, I have one question, that how far, like most of the population nowadays, they use contraceptives. So how far one should stop using contraceptives while planning to have a baby, like for people with disabilities and without disabilities?
See, Neha, I definitely agree with Divya that couples who have disabilities, before going for the parenting part or planning a pregnancy, the understanding amongst the couple should be perfect. As we can see in Divya's case, she was very lucky to find a partner who was willing to offer the support, help, and accept her as she is. So I think that is the ideal scenario. So the couple first should have the best understanding amongst themselves before daring to, welcome a third life into their family. And then only they would be able to look after the coming baby. And as Divya correctly said, pregnancy itself is a challenge in any couple with a disability. So there are so many things which they have to make adjustment in their life, in their lifestyle, and they have to look for better support. As she said, she could not walk, so maybe she needed more help at home. So you have to identify that these people will be the caregivers. This is how I will cope up with my professional demands, and How do I carry on with my life? So all these plannings and adjustments have to be done before you plan for a baby. So contraceptives nowadays which are available are very safe, and they are very low dose. So for me, if you ask, the first choice would be a barrier, which if not acceptable to the male partner, then we do give low dose oral contraceptive pills. So we all know barriers inherently have a 30% failure rate. So maybe they are not the first choice of contraception if you are not definitely intending to be pregnant. We must go on a low dose oral contraceptive pill because that is very, very safe. And the moment you stop the pill, the pregnancy can happen. So you have to continue with the pill till you want to be safe. So it's not that I'll stop oral contraceptive in the month of January and I'll have a baby in June. No, you can conceive right away whenever you stop the pill. So you will only take the contraception till the time you do not want to conceive. The day you think I can have a baby, stop the pill and you will have a pregnancy. So the carry home message is these pills do not have a, the subsequent time. They are only effective as for birth control till the time you are taking the pill. In the very next cycle, your fertility is restored and you conceive. I hope that answers your question. Is there anything else you want to ask?
No, ma'am, it's clear.
Okay.
Okay, so my next question is for Divya. What was your mode of delivery? Was it natural or C-section?
It's a C-section and it's an elective procedure because I have that sensation issue and the contraction, everything is not under my control. So doctor prior hand, she informed us that it should be a C-section and it should be elective procedure after full term, like in the 37th week, 37th after completion of 37th week, we delivered a baby. Yeah, and she also informed me of any pregnancy also, sorry, preterm thing also, because if I could not carry throughout the full term, she told us to, she informed us about that preterm also. So luckily I carried till 38.
Dr.Seema, which is the preferred mode? Like, is only C-section like the preferred mode, or do you all go with natural births also for like people with neural tube disabilities?
Nipuna, it will all depend upon the amount of disability. So if we are lucky and we have somebody with a minimal disability, then we can offer a natural childbirth also. But in majority of patients, usually we end up doing elective cesareans because these pregnancies are very, very precious pregnancies and you want to do everything in a planned manner. So if the patient cannot have the sensation of pain and we know she will not be able to bear down and cooperate in pushing the baby out, then safest is to do a planned delivery. And as Divya rightly said, there is a risk of premature delivery in such cases. And if we are lucky and we can go up to term, then after 37 complete weeks, the delivery can be planned to avoid an emergency situation where in the middle of the night the patient is going into labor, because in such cases we like to avoid emergencies because it is easier for Divya to come hospital during the day, do it in a planned manner rather than running in the middle of the night with breaking of the water bag. So once 37 weeks are complete, then we can safely have an elective cesarean and have a safe mother and a safe baby.
Thanks for sharing. Divya, again, back to you. If you don't mind me asking, do you have a shunt?
No, I don't have shunt.
Okay. So, Dr. Seema, what are the typical complications for women who have a shunt during pregnancy?
Nipuna, most of the times, see people, I have done cesarean for 2 patients who had shunts. So those were the patients where the neurosurgeons had advised us against giving them a trial for normal birth. So fortunately for us, during the surgery, we did not face many complications. And definitely we give them a good antibiotic cover so that there is no risk of intraperitoneal or intra-abdominal infection following the surgery. As a result, it can result in the blockage of the shunt. And while operating, we are careful so that we do not damage the shunt. And we take care of the proper hemostasis while operating and give a good antibiotic cover. So in my experience, the two cases I have dealt with shunts in situ, the neurosurgeons did not give us the clearance for vaginal delivery, and due to the medical reasons, we had to do cesareans for both.
Thank you, doctor. Next, Neha, can you take up the next question?
Yes. So, doctor, for women who have undergone bladder augmentation operations, so what are the precautions that are needed to be taken while their delivery process?
See, fortunately for us, it is not a very common procedure so far. So there are very few indications where this procedure is offered, and one of the the population where it is done is the people who have spina bifida. So in last decade or so, the science and technology has got so advanced that people like Divya who have spina bifida have healthy pregnancy outcomes. If we go back 2 decades, then nobody would dare to have babies or these procedures. So wherever the augmentation of bladder is done, I have reviewed the data, though I personally have never operated on a case like this, but the review of the literature says that when we do a cesarean in such cases, we have to be careful about the anatomy of the bladder, because sometimes post-operative there can be adhesions between the intestine, the omentum and the bladder. And if we are not careful, we can end up causing trauma to the bladder or the neighboring organs. So we have to be more careful as surgeons, but most of the cases did not have any intraoperative or post-operative complication. So the deliveries had to be done by cesarean section. Yes, there is a risk of recurrent urinary tract infections for these patients during the pregnancy. And while doing surgeries, we do catheterize these patients, and we have to be careful about the risk of post-op urinary infection. So that antibiotic prophylaxis has to be given.
Okay, also about the breastfeeding positions for mothers who have like lower limb disabilities and other disabilities. So what are your suggestions about the breastfeeding positions for them?
So Neha, should we ask Divya what was her experience with breastfeeding? Was she able to breastfeed her daughter? Let's hear from her. Huh?
Yeah, yes, doctor, I'm able to breastfeed her. But the thing is, yeah, there are certain positions we should give her, right? But I could not do it because when we are breastfeeding her, we have to be in a straight position, holding her. So I could not do it. By default, I'll become lean, and some positions were not comfortable. But I started, the thing is, I should be honestly say this, my baby started adapting to me. That is what I would say, because when I compare to other kids of my same journey, they were facing so much difficulties when the way I hold her, or when I put her, because I will be lying down and I'll also put her also beside to me. That is what I would say, like she adapted to me, because other kids, they face so many issues, but in my case, yeah, I'm able to cope up with that.
So I think Divya has given answer to our question, that which is the position we should be encouraging for breastfeeding for all these mothers. See, the position which is comfortable to the baby and the mother is the best position. So as Divya correctly said, the babies many a times would adapt to the mother's postures, and it is very safe for the mothers to feed the babies in lying down position. Now, gone are the days when we used to recommend that you should only, get up, sit up straight, and then breastfeed. That doesn't hold true anymore. So all mothers, if comfortable, can feed their babies in lying down position also. And then nowadays we are lucky to have, breastfeeding experts, and they do prenatal counseling to educate mothers of various positions. And there are feeding pillows also, which can be taken, and the babies are adjusted so that mothers do not have to hold the babies. The weight can be rested on the pillow, and then the mothers can latch their babies comfortably. So any position which is comfortable to the baby and the mother is the best position.
Yes, doctor. And also there has always been assumptions revolving around the fact that a disability can be passed along to the next generation. So could you show us, shine us some light on how far of a truth that is?
See, when we talk about spina bifida and neural tube defects, there is a risk of inheritance. We cannot deny that, because they say in a normal population, maybe 4 out of 1,000 babies have a risk. Like 0.4% is the risk of neural tube defect in a general population. But if one of the parents has a neural tube defect, then automatically this risk increases to 4%. So almost 100 times more risk. So risk of inheritance of neural tube defect is there. But I would say we are lucky that nowadays it is diagnosed very early. We can even pick up NTDs as early as 11 to 12 weeks of gestation. And if there is a baby or a sibling with neural tube defect and a parent also, then this risk increases to 20%. So the risk of inheritance is there. It is there. But there is one, positive ray of hope. See, when we say that the risk is 4%, still 96% of the babies may be normal, no? We are just comparing to the normal population. We are saying the risk is 10 times higher or 100 times higher. But there can be 90% babies who are normal. So it is not 100%. It is not like the penetrance of the disease is not 100%. The risk is higher, but still there is a chance that the baby may just be normal. And I hope Divya's baby is normal, if I'm not wrong. Yes? Okay.
Yes.
So great. So she's a live example to us that not all babies will have. The risk is higher, but we are good to have normal babies also. Yeah.
And doctor, what would you, excuse me, what would you say the right age to have a baby, especially for a person with a disability? Or if somebody wants to do it sometime in the early 30s or late 30s, what sort of care that they must undergo?
See, I would say the best preconceptional advice is the earlier you decide to have babies, the better it is. So there are two things. One is your biological age. The second is your conscious decision of being a parent. So those two things are entirely different, and sometimes they don't go hand in hand. I might not feel like having a baby because of my professional goals or my family circumstances or my financial restraints. But at the same time, my biological age is increasing. And as a result, the aging of my eggs is happening continuously. So these are two different things, but biological best age is having babies less than 30 years of age. Why? Because see, we say the incidence of miscarriage increases many times as your biological age grows. In a normal population, there is an incidence of 10% pregnancy wastage. If 100 pregnancies happen, then 10% pregnancies can go waste. Once you are near 35, this incidence doubles. And once you are more than 35 years to 40 years of age, the risk of miscarriage is 30%. So 1 in 3 chance of having a miscarriage because the biological age of your eggs is advancing. And those eggs would not be as healthy as they were 10 years ago. So the best age to have baby is less than 30 years of age if given a choice. And if you don't have a choice, then the earlier the better. Okay.
Yes, do we have any test that a person can undergo that talks about, that shows us how healthy the eggs of a woman?
Yeah, we do a test for ovarian reserve. So when you're talking about the quality of eggs, we are pointing towards the ovarian reserve. So ovarian reserve nowadays is tested by two things. One is the lab values, the blood test, and the second is the ultrasound. For the lab values, you can go for serum AMH. It is anti-Mullerian hormone, and FSH, follicle stimulating hormone. So these are the two hormones which are indirect indicators of the ovarian reserve. And the third is an ultrasound, which we offer on day 2 of your menstrual cycle to look for the antral follicle count. So on that, we are able to count your eggs or the follicles and tell you how good or bad the ovarian reserve is. So these three tests, definitely they are indirect markers, they do give us a clue that how long you should wait. If you have a good ovarian reserve, I'll tell you to conceive, let's say after 30. But if you have a poor ovarian reserve, then you please start planning early. So that is how it goes. Yeah.
Thank you.
Okay, so Divya, can you tell us about your post-delivery healing process? Like, was there, did your gynecologist ask you to take some special precaution or special care? How was life after your delivery?
Yeah. So post delivery, it was like it was a new phase of life to me, right? So I was stressed also because I could not handle the baby, and my husband was always there from the day one. Uh, and that postpartum thing is, we all, I mean, for no reasons I get angry and I shout at everybody. I don't know that reasons, because that is how it is, and doctors were also advised that that is how it would be, and the family members should be there for them. But I didn't take any medications or something to avoid that. But the moment when I get angry, right, the very next second, if I see my baby, right, so everything will go off, and yeah, I come to normal. And the biggest support is my husband and my daughter. So because of those two people, I could able to manage, because I could see even my friends who are normal persons, with persons without disability, they face a lot of challenges post this delivery. And one more thing I wanted to say, like, I could see uh, people restrict themselves after having a baby, right? So say for example, they will even quit their job, or they will stop doing something what they dream of, right? But in my case, it is totally different. You all, I mean, when you see my uh, videos and all, you could see that I started exploring various other activities along with my daughter. Right from the fourth month or fifth month, we started going out together. She adapts me very well. We go for marathons, we go for inclusive fashion shows. So everything, all the other activities, any other activities, I did along with my daughter. So that is how it was. So that gave me the confidence. That is the journey.
Thank you, Divya. Dr. Seema, would you like to add something about the care that should be taken post-delivery?
Yeah, it is so amazing to listen to Divya's, perception of life. And today itself, like we were celebrating Mother's Day at our hospital. So there was a small function, and the guest of honor was an IAS officer. So she was sharing her experience. So she exactly said what Divya has said, that for women who are especially working and ambitious, having baby should be part of the career planning. So the career should not stop when you have a baby. You should plan your career along with the baby. So I always tell my patients, see, one thing should not come at the cost of the other. You think I'll have baby once I become a CEO, that's not done, because by the time you decide, you'll be 40 and your eggs will be really gone. And on the other hand, if I think that I'll start studying once my baby is 5 years of age, that day will never come, because as they grow, their demands, they increase. So the best way is to, model your career path in a way that baby and career goes hand in hand. And I think Divya has very nicely said that if you include your baby into everything you want to explore, then you don't need to stop there, right? So when it comes to the postnatal care for any mother, and especially mothers who have some disability, so a very big role comes of the caregivers and the family and the spouse, because all postnatal mothers, they go through these postpartum blues, as Divya went through the postpartum blues when she was crying and she was getting angry. So this happens for everybody. I even remember my time, I used to cry so often on such petty issues which should not bother you otherwise. But this is all thanks to the roller coaster which is happening in your body because of the changes in the hormone levels. See, during our pregnancy, the estrogen and progesterone levels are 100 times higher. And once you deliver the placenta. In the postpartum phase, these hormones, they drop drastically. So such low level of the hormones in the body, where the brain was used to 100 times higher level, they push the mother into, you can cause it postpartum depression or pregnancy blues or postpartum blues. So it's very, very physiological. But all mothers usually come out of it. 1 on 10 sometimes need some medical help. So with a good family support by the spouse, assistance and help, and which keeps the mothers in a positive mindset, I think this can be easily tackled.
Thank you, Doctor. My next question is, we've been talking about mothers with neural tube defects. So, if there is a would-be father or with neural tube defect disability or any other disability, so what are the special tips or precaution that he must take? Whether he should take folic acid level, like he should be taking some special medications or anything before like he's trying to conceive.
Nipurna, I'm sorry, I could not get the question. There is some problem with the signal, maybe at my end. Can you just repeat it once?
Yes. This question is from the perspective of a would-be father. If he is a person with a neural tube defect or lower limb disability or anything, so what are the tips for such a father?
See, usually the role of folic acid is for the mother, because in utero, the development of the baby is going to take place in the mother's womb. So if you talk about prenatal supplementation of the vitamins, we do not recommend it for male partners unless there is a problem with the semen count. So usually when we evaluate the couple, we get a husband semen analysis done. If the quality of semen is good, then we let them be. We do not give them any prenatal supplements before planning for a baby. But yes, if the count is less or the quality of the sperm is not that good, then we do give them antioxidants, multivitamins, and vitamin E. This is the vitamin C, E, and A basically. So we give them few antioxidants to improve the vitality of the sperms. Otherwise, usually folic acid is not given to the male partners. Not to the best of my knowledge, no.
Thank you, doctor. So I am done with my questions. Neha, Chandana, any more questions?
No, I'm done with mine.
Chandana?
Is there any questions from audience who wants to ask some questions? They can raise their hands and ask some questions. Or okay. So should we actually I just wanted to ask you, ma'am, a question. If if a person with spina bifida or neural tube defect has gone through with bladder augment surgery, then how you will take care of that pregnant lady, or during delivery, how will you take care? If you have any experience, just share with us.
I think we already dealt with this question, if I'm not wrong.
Yes.
Yeah, so we already answered this, that we have to be more careful about handling the bladder and the intestines and intra-abdominal organs when we are doing the surgery. We have to take care of the urinary tract infections in the post-op period. And in most of the cases, bladder does not interfere much with the cesarean. because whenever we are doing cesareans, the uterus itself grows so big that we have enough place to give an incision and deliver the uterus. So bladder augmentation does not bother us, but we have to be careful with the intra-abdominal anatomy when we are pursuing our surgery.
Okay. I think so. Sambhavi wants to ask something. Yes, Miss Sambhavi.
Hi friends and hi doctors too. I just want to share my gratitude by seeing this video. It's very kind of you people and the doctors to share your views and everything, so that one can aware that every person and every male, every female actually can conceive, because we see in a lot of nowadays that being with disability or inability comes with a price, like sacrificing their happiness or sharing everything. But I think through this video I can say that every female can produce themselves with happiness, and that even though we are having a disability, we can experience everything, not only career, not only this one. And thanks for Divya ma'am for sharing your experience that can clear many of the doubts I am having regarding my friend. I am very happy for joining this event, and thank you, Dr. Seema Garu, for clarifying our doubts regarding both normal persons and everything. I'm very glad to be in this event, and thanks Chandana for sharing this event with me. Thank you.
Thank you, Sambhavi, for sharing
Thanks,
this.
Sambhavi. Yes. And I just have quick, not a question, but I just would like to ask Divya. Divya, what is the best part of the motherhood that you've had so far? I mean, I guess you have went through quite a few ups and downs, but for some reason, I think you're that kind of person. Even this is something that I felt last time we spoke with you, is that your experience always makes me look forward to them, though I know it comes with a lot of hiccups. So yeah, please do tell us, what's the best part about the motherhood?
It's a wonderful journey, I would say, because when you have a kid, right, she reflects you. So whatever the thing you want, she will be there. There are occasions where when she was around 8 or 9 months, when she was not talking, during the time if I fell down, she will go and communicate to the person. I mean, my husband will be working in the other room. She will go and explain him. She cares so much about me. Like she what how could I say? She will be like my bodyguard. So wherever I go, my husband used to handle me, right? She is observing that, and the one best thing I observe from her is I don't need to teach her what is inclusion, what is accessibility is about, because she is observing from me, right, the things and all. So wherever I go, she knows how to handle my wheelchairs. Right from the age of 1.5 or 2, she knows even with that narrow path, other persons, any security or other persons, because while my husband is parking the car or vehicle, she knows how to handle that narrow passage, because she is observing that, right? And also she will never let others to touch my wheelchair, because I'm the person who will propel myself, but even then she will hold my wheelchair at the back, because other persons, will after seeing her pushing, others will come and offer me their help, right? She will never let them. I'll handle. So that is the kind, like, wherever I go these days, I'm not depending on my husband. She will come and she will go. And another thing I wanted to share, like, we used to have a conversation every night after switching on after lights. We have one night lamp, and she always asks me the doubts. And these days, she started asking the questions: why I'm not walking, why I'm not standing. So because she's seeing other mothers when she's playing, right, and other kids also asking, right. So I tell about this Spina Bifida and other things and all. So she what she's thinking is, this wheelchair is a kind of stroller I'm using, so that the moment I grow up, right, she's still thinking that I'm yet to grow. If I have enough food and I get strength and I can walk. So every time if you offer her anything, right, she'll give an extra piece to me. Ma, you have it. You get the strength, then you keep this wheelchair up, and we both can walk together. So likewise, she's handling me, and she knows. She's getting used to it. She knows now. She knows what is spina bifida now because I keep telling. And sometimes she knows that waiting and all, right. Uh, I thought like let her know it because that is how it should happen, right? So I feel like she's my bodyguard. Wherever I go, she's there to protect me other than my husband. So that is how it
That
is.
is that is so beautiful, Divya. Thank you so much. She really sounds like a rock star, and I can't wait to see her grow up. And we actually have a small video. I think we have played it at the beginning of the session, but if you haven't seen how adorable this mom and daughter duo are, let me just share it with you real quick, and it will make it across. Are you able to see the screen?
Yes.
Yeah.
Yes.
Yes, I just would like to share that real quick. Thank you, Divya. Thank you so much. And also thank you, Doctor. If anybody have any further questions, please ask away.
Hello, good evening, doctor.
Yeah.
I have taken USG of my daughter recently for the bladder augmentation. Then in one of the regarding ovaries, it is saying both ovaries appears bulky and shows multiple small similar size peripheral range polyps.
Okay.
1.2 centimeter oval cystic area abutting the left ovary may suggest exophytic cyst, paravorian cyst. That means anything I have to show to the gynec that.
How old is your daughter?
She's 25.
And what is her weight? Is she overweight?
Yeah, she's little overweight because of the job and all is work from home and all now maybe.
And are her periods regular?
Yeah, periods are regular, doctor.
Okay, so then all she needs to do is maybe reduce little bit of her weight and correct her BMI, because these polycystic ovaries are usually, they cause little hormonal disturbance, and overweight adds to the problem. So if her periods are regular, then you don't need to worry about this finding of bulky ovaries and a para-ovarian cyst. You can ignore it for the time being.
Okay. She has to reduce her weight, then everything will be.
Reduce her weight, yes. But in case she starts getting irregular periods, or she has a lot of acne, or if she has hair growth on her face, then you can see the gynecologist. If she doesn't have any of these symptoms, then all she needs to do is maybe modify her diet, and if she can do some workout to reduce 4-5 kgs of her weight, it will help her.
Okay. The symptoms, what I have to see, doctor? Can you repeat for me?
Excess of hair growth on her face, or if she has acne, or if her periods become irregular.
Irregular, okay. Yeah. I need not, consult a gynec at this moment and
not for the sake of ultrasound. If she doesn't have any symptoms, then you can relax.
Yeah. Okay. Thanks a lot, doctor.
Yeah, thank you. Thank you. Before we finish the session, Chanda, I really want to thank you. Heartiest thanks for making me part of this session, and interacting with Divya was just wonderful. And Divya, all the best to you and your daughter. And I really want, if you have any future sessions, I would love to be part of it. Give me an opportunity. Yeah. And happy Mother's Day to all the mothers who attended today's session.
Any more questions if someone wants to ask So please ask. Otherwise, we'll move ahead. Okay. So I don't think so. There are questions. If someone are not ready or reluctant to ask here, they can mail us on given mail ID. I have shared in the chat box. Please go through it. Now we go further. Actually, we are very thrilled with the journey of Divya. So, disability cannot stop you from having a baby or becoming a parent. This was Divya's journey. So, this talk was actually focused more or less for biological experience or complications or etc. But there are different options like adopting a child or going for a surrogacy. Still, you can be a good parent as Divya is and her husband is. So do not hesitate if you really want to become parents, go for it. Now, I will not take much of your time because this is a Sunday evening and you must be having your plans. So now we move on to the end of this session. So first, I really want to thank Divya for sharing your experience and inspiring others. Thank you so much. And secondly, I would like to thank Dr. Seema Sharma. She actually immediately when I called her, she said, "Yes, I can." Actually, she was busy with her some sort of webinar, I think so. And but she said, "I will manage. I will actually join this webinar." And she said yes, and she joined this. And and thank you for sharing your experience and taking out time from your busy schedule and managing it. And actually this will help this will definitely help persons with disabilities to deal with it. Thank you, ma'am, and we look forward if you can help us more in such sort of things.
Yeah, sure. It
uh,
will be a pleasure. You let me know anytime. I'll definitely try to make it possible.
yes, thank you. Thank you, Hari Chandana, Nipurna, and Neha for doing it well, coordinating throughout this session. Thank you, girls. But last but not the least, all our participants who had attended the session, thank you so much. Thank you.
And just for everybody, the session will be uploaded on Spina Bifida Foundation YouTube. So anybody wants to go back and truly listen to the answers, it's always going to be there. And thank you, Sneha, for coming up with the Mother's Day idea. It's all her. She made it happen. So thank you. And also thank you, Divya and Doctor. You have done tremendous amounts of help to the versus community that we much need in this day and age. Us women have to stick together. So thank you so much.
Okay, thank you. Bye-bye.
Thank you. Yeah, bye. Have a good evening.
I'd like to say thank you, Sneha and team.
Thank you.
For this. And
Thank
ma'am, nice interacting with you. I thoroughly enjoyed our informative event. Thank you all.
Thank you.
Bye.